right. So hopefully everyone can hear me okay. Um, and thank you for joining us today. As Rebecca said, we will be recording this and we'll send it back to everyone who registered for this today. And we are going to take questions at the end of the presentation. Feel free to put them in the chat in the meantime. So again, let's get started. So we're here to talk about the newest proposal for Medicaid work requirements. And hi, quick introduction. My name is Camille Rishu. I'm the Health Policy Director at Arkansas Advocates for Children and Families. And just a quick agenda for us. We're going to talk a little past and present. So the past being the first round of Medicaid work requirements, a little history lesson from 2018. The present, the current Pathway to Prosperity waiver, work requirements 2.0. We're going to talk about some of the major components about it to know how folks might be affected, some concerns that advocates has about the proposal, and we'll talk a little bit about the twist of federal side work requirements being considered in Congress, and then we'll kind of talk about our next steps, what we'd like folks to get involved with afterwards, to share comments, and to get involved with our advocacy work. And then we'll do a quick Q&A. So let's go ahead and get started. So first, a little bit of history. So in 2018, Arkansas was the first state to pass a work requirement or work reporting requirement. So in 2018, we requested permission to amend our Medicaid expansion, which at the time was called Arkansas Works. It is now called Our Home. And we asked to be able to do work requirements reporting. So like I said, we were the first state to do this. The big kind of components of the first request were for any Medicaid expansion, Arkansas Works enrollees ages 19 to 49 who were not part of 10 exemptions. And some of those exemptions included being a recipient of temporary employment assistance, being pregnant, attending school full-time, having a dependent child in the home, things like that. Those folks, without the exceptions, had to report monthly that they completed at least 80 hours of work, school, job training, volunteering, or job search activities. The reporting at the time had to be completed on a DHS online portal monthly. And because there were a lot of problems with that website where people were unable to report on it and it was glitchy and there were issues, they later allowed it to be reported by phone after those issues arose. So if an individual went 3 months without reporting, either consecutive or non-consecutively, they could be disenrolled, have their Medicaid coverage terminated. And then that person had to wait a year until the next re-enrollment period, unless they qualified for another type of Medicaid in the interim. So if they became pregnant or something along those lines. So as the result of that, we have pretty solid data that shows that this was not an effective policy. So 7 months into the requirement, 18,000 Arkansans, or 1 in every 4 Arkansans that was subject to this reporting, lost health insurance. In the end, most Arkansans lost coverage because of administrative reasons, not because they weren't working. 95% of those affected met the requirements, or they should have been granted an exemption. There were errors cited during the process, people being disenrolled despite attempting to report or for qualifying for that exemption. And then in August of 2018, Arkansans who lost coverage sued, and they argued that the government's approval of this work requirement waiver violated the Constitution and the Administrative Procedure Act. There is in Medicaid law that changes to be made to it in these types of waivers must promote the objectives of Medicaid, which is giving people health insurance, expanding their health coverage, and improving their health. So the judge determined that the work requirements would not promote the objectives of Medicaid, and that the secretary failed to adequately consider the impact of the proposed project on Medicaid coverage. There was no evidence that this program, this project led to more people working, in part because most of the people who were working, who were subject to these requirements were already working. So people did not become healthier, nor did they see any improvements in employment at the first time this came around. So now we're in the present. So our new version of this is called Pathway to Prosperity. And this is whenever you see 1115, that is a type of a way to waive Medicaid law for demonstration projects. So pilot projects that may deliver healthcare better or have some kind of experimental component to it. So Arkansas's Medicaid expansion, because we do ours a little bit different than every other state, is actually an 1115 project. So the current version of these work requirements apply to all individuals under the Medicare age of 65. So all adults age 19 to 64 who are part of our Medicaid expansion group. So those are people who have incomes ranging from $0 to 138% of the federal poverty level and are covered by a qualified health plan. So through our home, formerly Arkansas Works, our Medicaid expansion. So unlike the last time, there are no exemptions to participation that are outlined in this waiver, not those 10 exemptions that existed last time. Individuals are going to be assessed by DHS as being on track or not on track through a combination of data matching and success coaching, which we'll talk about a little bit soon. Those who are identified as at risk and not being on track will apparently have the opportunity to receive focused care coordination services to support their health and economic self-sufficiency. So that's, we're going to break down just a couple of parts of this. So first, data matching. So they are going to, through this waiver, they're proposing that through automated processes, through pulling information about those who are insured through our home, that they're going to identify people who are at risk for poor health outcomes due to long-term dependency who would then be subject to this requirement. They do not say what specifically defines someone as being at risk, but they do list a number of factors that go into deciding if someone's at risk. Those can include the number of hours that you worked, the amount that you make per hour, your education status, presumably whether you have a degree or not, or whether you're in school, whether you have a high school diploma, college degree, the length of time that someone has been eligible for Medicaid or our home, and having a child in the home. So, like I said, the waiver does not specify a minimum number of hours that are required to even be compliant. So, unlike last time where it was 80 hours a month, this does not say a minimum number. So there's an undefined process on how are they weighing this? Does having more hours mean that you're more likely to be compliant? Does a higher salary per hour, is that better? It does not really clarify that in the proposal that triggers them into the success coaching requirement. All right, so the next part of that is the success coaching. So if you're deemed to be at risk based on this undefined algorithm, then you will have to participate in success coaching. So the success coaches, the waiver claims that these are going to provide intensive coordination to improve the health, employment, education, and community involvement. And they do not specify who, like what type of professionals that these are, but they name some possible entities that may be hosting these success coaches, including the Arkansas Workforce Centers, the Arkansas Career and Technical Education, as well as local community partners, vaguely. That success coach is going to meet with an individual who's been referred to decide whether a person who has Medicaid coverage is on track or not on track. That is an individual discretion decision, it seems, in the waiver. And I'm going to talk a little bit more about what the waiver says that those success coaches are going to do. So these are the roles of the success coaches. They're supposed to report in their DHS approved case management system. They're going to identify any health-related social needs and assist individual access to access community resources and services to address their health-related social needs. Health-related social needs are things that are not directly healthcare, but they impact your health. So those can be things like you have your heat turned off and it's cold because you're struggling to make ends meet. Or it could be maybe you have access to a doctor, but you don't have transportation. All of those wraparound parts that go into healthcare but aren't, directly doctor care. So they're supposed to be able to assist and link them to resources. They are also supposed to, as part of the requirement, develop a personalized development plan that facilitates opportunities for employment, education, training, interviewing, resume writing, and they're going to identify those goals and measure progress for 3, 6, 9, and 12-month periods. Next, they're going to track and document the progress of those personal development plans and the linkage to care every month. And part of the argument that they're doing this is to say that unlike last time where individuals had to report, that the success coaches are going to be reporting this. So it pulls out that monthly reporting requirement. The difference is that instead of a beneficiary, an individual going onto a website or calling a number to report their hours, they're now having to do meetings scheduled with these success coaches monthly. So actually a longer period of time potentially if they have to meet certain goals that this success coach names. And then they're going to do monitoring, follow-up activities like verification of their engagement and a final determination towards their goals. Needless to say, this is an insane amount of work. This implies that hundreds of thousands of beneficiaries will have access to what appears to be professional social workers who have the capacity to do this type of specialized health-related social needs linkages and job development training. So it is not clear how those workforce centers that presumably already have full-time work are going to then be doing this as well, or if they're going to be new professionals that are placed into these centers. That is not made clear in the waiver. The third part that I kind of want to pull out is if a person is deemed to be on track or not on track. Like I said, it is unclear what standard criteria will be used to determine this. They can decide that they are not compliant within 3 months, and they can be moved in towards having their coverage suspended. There is not laid out in the waiver a set way to determine whether a beneficiary is on track or not on track. So one of the questions that we have is what will determine that and what quality assurance there is there for beneficiaries on different sides of the states with different success coaches. So if they're determined after 3 months that they're not compliant in this requirement, a 3-person DHS panel will suspend their coverage through the end of the calendar year. And then at the end of that year, during their determination period, they will have their coverage terminated. So importantly, during this time, DHS is not going to pay for their premiums, and those individuals will not have coverage. Per DHS, they would not have to reapply if they became compliant, but they will not have they will not have their coverage during that time. If they go to the doctor, Medicaid will not pay for it. If they go to get a prescription, it will not be paid. So they will have their coverage suspended, but they won't be removed entirely from the program. And if the suspension is approved, the individual will receive a written notice of the action with a right to repeal, just like any other adverse action that can be appealed with your Medicaid coverage. It does not clarify who that 3-person DHS panel is, how often they will meet, what the protocol is for that. So within the waiver, there's a part that I wanted to pull out that DHS assumes that of the people who are assigned to this requirement, 50% of them are going to cooperate and be on track, that 25% will be early movers due to change in their household income. So something about this is going to increase their income, and they're not going to be Medicaid eligible anymore. And that 25% will fail to cooperate and have their coverage suspended. So of those who are subject to these requirements, they assume that 25% are going to have their coverage suspended, which is the same amount that last time work requirements were implemented. We saw the same loss in coverage, 1 in 4, 25% loss coverage during this time. So if I haven't already kind of hinted at some of them, here's some of the concerns that we have about this, that you may be wondering how it may affect you, the clients you serve, your partner organizations, or members of your community. So our biggest and first concern is that what makes someone ineligible, non-compliant, not on track is not clear. It's not defined. And it seems to be a subjective calculation for deciding who it is. We don't know how much, someone's being punished, presumably for being poor longer. If they've been working the only job in their area, especially in rural Arkansas, where lots of folks are insured through Medicaid, you're taking the only job available to you. So if that job makes you eligible for Medicaid, whether there's, variable shifts, if you work different numbers of hours, if you can't get a raise because that's what the job in your area pays, are you being punished for that by not being able to make more money or to not have a more standard schedule? We're very concerned about who decides who gets to deserve health care. The next part that we're really concerned about are the success coaches. They seem to be unknown third-party entities that get to decide who deserves health care and who doesn't, that are going to be doing hundreds of thousands of visits monthly with beneficiaries and deciding whether they're on track. So our concern is that will a success coach at one part of the state look at an individual with a set of circumstances and say this person is on track, whereas another success coach on another part of the state has a person with very similar circumstances say you're not on track? What are the ways, without any standard protocol that's clear in the waiver, like how do we know that people are going to be treated without bias, or like when you have one person deciding what that person needs to do to continue to receive health care, their issues. Kind of straightforwardly, suspension of benefits is taking away health care. There's no difference in suspension versus termination other than you're not shredding someone's paperwork. And kind of on a baseline level, all of the data that we have from the last time this was implemented shows that work requirements do not make people healthier. They do not improve their employment. And we said this in our public comments that if the state is committed to addressing poverty through increasing education and workforce development, addressing health-related social needs and adding in resources, especially to rural Arkansas, to improve people's employment, their health and financial well-being, to better care for their families, we strongly support that. We just don't think you should jeopardize people's health care in order to help them improve their health and family well-being. And I know I'm throwing a lot of information at you, but we're just going to briefly touch on the twist of Congress federally considering work requirements. So there's currently kicking around in Congress some proposals to make deep cuts to government spending. A lot of those cuts would come from programs like Medicaid and SNAP. There's no other way to cut that spending without cutting Medicaid and SNAP. One of the ways they're proposing to make some of those cuts are to implement federal work requirements across states that have Medicaid expansions. Those federal work requirements look a lot more like the 2018 Arkansas requirements. So the 80 hours of work or job training or education, and with those exemptions that were mentioned. And what we're concerned about is what happens to Arkansas and what kind of confusion and overlapping conflicting burden will happen to our Medicaid population if we have both of these occur. So these two requirements, or these two work reporting proposals, have different requirements. So if one goes into effect before the other one, how are beneficiaries supposed to know what they're supposed to do? And what if they conflict? Is the state going to go with the federal ones? Are we going to try to attempt to have two of them at the same time? They are different, and that is going to be really confusing and cause an administrative, boondoggle for, folks trying to get health care. So we just wanted to highlight this as a potential twist that could make things even more complicated for people. Ultimately, what we're trying to get at is more barriers to Medicaid equals a sicker Arkansas workforce. Medicaid covers hundreds of thousands of Arkansans, including 200,000 Arkansans who are covered by our home expansion. Their health care goes into their ability to care for their families, to keep their job. And we do agree with one premise that the waiver proposes, that low-income families do face higher risks to their health because of their built environment, because of access to healthy foods and health care that is preventative and timely. But the solution to that is not putting them in a more precarious situation by, stripping them of their health care. So with all that information, what are the next steps? We want to give you some opportunities to maybe, get involved with our advocacy, and we are asking you to mark your calendars because we're currently in the middle of the federal comment period. So this waiver was submitted to federal CMS, federal Medicaid, and we are currently in the 30 days in which they are taking public comments. So what we are asking is if you are an individual, an organization, a representative, or community partner who has concerns about how this might affect you, might affect the clients you serve, your community, we want you to submit a public comment. The deadline to submit that public comment is May 9th, and we are going to be sending out this this PowerPoint so you can have the link and the access to it. We'll throw it in the chat, and I'll just kind of show you a brief, let little bit of information about how to do this. So if you click that link, it's going to take you to our website with some information, the full proposal, some takeaways from it. And if you'll see in the circled area, a link that says you can submit comments to the federal government outlining your concerns. So if you click that, it's going to take you straight to the Medicaid.gov website where you can submit comments. So you will click submit comment there, and you can either attach a document, you can submit your comments that way. We would really appreciate you to let them know, because the folks at Medicaid are going to be deciding whether to approve or deny this waiver, and they need to know the specifics about how folks could be affected by this, what concerns there are, whenever they take into account how Arkansas may implement this. So you can submit comments there. And then our last ask of you is that my colleague Haley, our health policy associate at Advocates, has been putting together a town hall to talk about how work requirements could hurt Arkansans. We are co-hosting that with Arkansas community organizations, and it will be next Tuesday, April 29th at the Arkansas Education Association beside the Capitol. We would love for you to come out and connect with us, because we are very concerned about folks being losing coverage during this. And if you are someone or know someone who lost coverage during the last work requirements, we want to hear from you. If you're concerned you're going to lose them during this, if this is approved, we want to hear from you. So please connect with us. That link is more information about our town hall. And now that I've talked a whole bunch, I can take questions and stop sharing my screen. But here's my contact information. If you need to reach out to me, please do. And please ask questions. And if I don't know the answer to something, we will get back to you. So, and I'm gonna stop my share. Okay.
Thank you, Camille. We have lots of questions. Like Camille
Oh,
said,
gosh.
we have plenty of time, so keep them coming. Our first question is, so if we have a developmentally disabled person on Medicaid, are they automatically required to work?
No. So the work requirements that are being proposed are for the Our Home expansion population. So if you have a developmental disability, you are probably insured through a different type of Medicaid, potentially also through Medicare, which serves people older than 65 and also many disabled folks. There are some other Medicaid programs. This waiver specifically is for the 200,000 plus people who are defined as non-disabled. That does not mean that everybody who is going to be subject to this does not have some type of disability or chronic health condition. It's just about the type of coverage.
Thanks, Camille. And kind of along those lines, we also had a question. So you just said this is specific to Our Home. Were there any requirements included that are specific to people on past Medicaid?
No, the passes are also, that's more traditional Medicaid coverage. So these are for folks who, that is through Our Home coverage. So that is for people who if you apply for Medicaid and your card says, maybe it's Blue Cross Blue Shield or Ambetter, it's one of those qualified health plans. We can if you reach out, we can help you figure out if that's the coverage you have. But for the passes, those are going to be with your traditional Medicaid. So again, not subject to this requirement.
Our next question, there's a shortage of social workers in the state. Where do these folks come from, and what are the educational license requirements?
That is a really good question, and a question that I have myself, because it is not clear in the waiver. The way it describes what these success coaches are going to be expected to do they're described as licensed social workers just by those 5 different requirements and what they say they're going to be able to do, community linkages, that seems like a full-time social worker position that they're, referring to. So with a shortage of social workers already, I don't know. And I think that's a good question, maybe to pose in your comments if you submit them, that with a shortage of social workers, like the ability to do all of these things that these people are supposed to do for people to be able to maintain their coverage seems very difficult with our current workforce.
It's a kind of wonderful thought, though, that there would be enough social workers to work with hundreds of thousands of Arkansans.
Yeah.
Representative Joy Springer is on the call. Thank you so much for joining the webinar. She has a question about the timeline and process of how the waiver is moving along. How can people get involved? And she's also very concerned about the point at which it gets at the rulemaking process and what that would look like.
Those are some good questions. Thank you, Representative Springer. We might need to follow up with you on the rulemaking side, but since we are currently in the comment period, there are waivers proposed from Arkansas to CMS that have been pending for actually years now at this point from the previous administration that have never been approved or denied. We expect these to probably be go through their process a bit faster. But we can look into what the timeline looks on that. At the end of the comment period, after May 10th, they will then consider it, and they may come back and say that they have to give more information or implement it in certain ways. But I don't have a specific timeline, but we can follow up with you to maybe find the answer to some of that.
Okay, next is a comment and question. Someone mentioned in the chat that there are, as you highlighted, very few jobs in rural communities. And even in some larger cities, and that people with pre-existing conditions can get turned away from jobs. And they're wondering too, and you can comment on that, but they're wondering too, like how this waiver would impact the elderly and children.
Well, so the waiver or the work requirements proposal is only for adults aged 19 through 64. So children are not included in it, and people older than 65 are also not included in it. And it's all the adult our home population. I do agree with you that many rural areas do not have enough jobs. So if you're taking a job that maybe has different hours or doesn't make very much, but it's the job you can get, there's that this waiver poses a problem for them. Pre-existing conditions, within the waiver, it says some things of, oh, we might shift them onto different coverage if we find out that they have a chronic health condition. So maybe they're on our home and they move them into the passes or a different, a medically frail category of Medicaid. In a way that still may be considered punishing them by changing their coverage as a result of this work requirement. So I still think it poses an issue to make any kind of change to their health insurance based on conditions that they may not be able to control.
Our next question is there a plan to integrate Arkansas rehabilitation services as well as passes for supportive employment work models to support folks?
I don't think, so this waiver doesn't really touch on that because the passes are part of traditional Medicaid. And so they would not necessarily be subject to this. So I just don't think that this waiver touches on them specifically. Can I see some of the next? Oh, yeah.
Yes, there's a lot happening in the chat. I'm trying to get to the
You're
next
fine, you're
question.
fine.
Um,
I'll keep working through them.
if someone has a story of losing Medicaid last time or fear of losing it this time, do we reach out to you directly?
Yeah, please reach out to me directly. As I said, I'll throw it in the chat again. And I would love to hear from you. It can be hard. I actually, during the webinar, there was a photo of a woman named Christine Cameron who lost coverage the last time around and who was one of the storytellers who talked about losing coverage. And part of the reason that she lost coverage was because she was escaping a domestic violence situation and she had to move frequently. So some of our most marginalized people in the state who have situations like that are going to find it difficult and who are going to be punished for, again, circumstances out of their control. So because the people who are affected by it are sometimes some of the hardest to reach people, we really do want to hear from you if you know someone, if you lost coverage in the past. So please reach out to us.
Any other questions? We got one question in the chat. Yes, I'll be sending out the recording and the slides after the event.
Yeah, and I see a lot of the comments on here. Arkansas won't hire rehabilitated felons with background. Yeah, where that is the case, and what happens if you struggle to find a job for half a year? What happens if you have a job and it doesn't make enough money and you lose coverage and you lose access to, I don't know, blood pressure medications or your SSRI, your depression medication? It makes you harder for you to maintain a job whenever people are already struggling. So that's our big concern about this.
I don't see any more questions in the chat or the Q&A right now, but as Camille mentioned, she is always available to take your questions and she'd love to hear from you too if this might
Please.
personally impact you, because we want to make sure we're talking to people directly and highlighting their stories. Camille, any final thoughts that you want to leave people with and just reemphasize how they can help and be part of the process?
Well, thank you for spending your morning with me, hearing about Medicaid. And I do want to reiterate to please submit a public comment, whether it's a short comment or a long, comment about, the complexity of the situation. They need to hear from you. You don't need to see this as an inevitability. And in fact, I know that there are going to be challenges to this if it passes through. And so you connecting with us is going to help us moving forward. Um, I I think it's one of the biggest takeaways is that because there is so much missing from this waiver and it is so vague, we still don't know who's going to be affected or how folks are going to be affected. So some of this we're going to kind of find out if it makes it through. So it's really important to stay connected with us. I would love to hear from you and let us know how we can help. So thank you again for coming today.
We actually got a couple more questions when you're wrapping up. So post wrap up questions. Is it required that Medicaid clients have an active access account?
I believe that when you apply for, I mean, I know you apply for Medicaid through Access, but that's probably a DHS question that I just based on applications, I would assume you have one, but if you maybe applied in a physical DHS office, that I'm not quite sure of.
And then there was a question about the public comments. I'm re-putting in the chat the link to our blog that provides a bit more explanation. And it also links to a place where you can provide public comments at the federal level. And we did get a confirmation, no, it's not a requirement at this time.
Yeah, thank you. I appreciate that. It is helpful to have an Access account because that's where you can access a lot of things for easily for appeals and documents. So it is a good idea to have it available to you. But thank you for clarifying that, Amy.
I think that's it.
All right. Thank you again. And please reach out if you have any further questions. Have a good rest of your day, folks.